primary role of an environmental health specialist is to educate and protect the public health. This guides everything we do during our food and lodging inspections.
We're out there to protect the public, to find the things that are going to make you sick and have the restaurants correct them.
Well, it can be, from mold growth from water condensation. It can be, from temperatures, controls over food. It can be, also for people with viruses that may contaminate food. We look for also, pests. For example, in hotels, where there could be a bed bug infestation. So things that can harm the public.
So we start with an inspection of their facility, and after their facility is inspected and it meets the requirements and the codes, then we issue a permit. Then we come back and we inspect that facility based on a risk factor. How many times they're inspected is based on their ability to get people sick and how the food is being handled. In other words, you have 4 different risk factors, so that would determine the frequency of inspection.
The first rule that came out from the state is, if the food is going to be heated to 165 degrees, it is not considered ready to eat.
From a commercial side, we're feeding the public, so we're very concerned about public health and addressing all the issues that people don't really think about at home, mainly hand washing, disease control, and making sure that we are dealing with food which does become contaminated through cross-contamination. So the facilities that we build today are modeled after the codes which address all these issues. And by doing this, what we're doing is we are establishing the safest environment that we can construct for new restaurants, new construction, remodel of current facilities. Restaurants which change ownership, we do transitional permits which allow restaurants to operate for 6 months before they have to complete all the requirements that are necessary to stay with the current codes. I spent a lot of time on the phone with potential customers, talking to them about what they need to have as far as equipment and lighting and floors, walls, and ceilings, and all the detail information that they're looking for, and give them the documents that they can find this information on their own.
Institutional food service on campus. I have swimming pool duties as well, tattoo artists, daycares, lodging establishments, residential cares, rest homes, kitchens and rest homes. So anything that would be under those rules that are inspected facilities, I have all of those authorizations.
ServSafe is a national accredited food safety class, and Orange County is fortunate enough to offer it 4 times a year. Effective January 1st, 2014, it is required that the person in charge of food service establishments be certified in a food safety class and be present during the inspection, or 2 points will be deducted from their score.
I worked in a number of restaurants and, been ServSafe certified, and I really enjoyed the knowledge that I gained through that and through quality cooking and safe cooking. I want everybody to enjoy the experience and be healthy as well. I know they're going to say, oh God, the health inspector's here, but I want them to go, oh wow, that was cool. She worked with me, she showed me some things, I really feel good about that. Now let me see what I can do to make it better. That's the way I felt, and I want to pass that on to them.
I do accompany our staff on a quarterly basis to at least one of their restaurants to do a ride-along, as we call them. It's basically to make sure that there's consistency in how we enforce and interpret the rule.
Example I often use, particularly when I have to inspect some fine dining establishments, they're the exact same rules as inspecting a McDonald's.
A lot of times they'll say, I've never met a health inspector. And it's sort of like an oddity, people know we exist and they know that we established the grading program, and they can see the grades for themselves when they go in the facilities, but they really don't see us out there in the field working.
It takes passion. You have to think about your family, whenever we go out to eat to a restaurant, or whenever we stay in a hotel, we want, a safe place to eat, not just for ourselves, but also for our families. So we have to think about that.
I have a lot of people who ask me for my opinion, like where do you eat and where you don't eat. And that's not how it works. Never going to say anything that would be considered negative or positive.
When I'm out working around the public, I feel like they're looking at me and they're saying, well, wow, this guy's out here, he's inspecting. I've never seen this before. He's out here protecting our health.
We are out there because we care about the people that we work for in this county.
It is a great job, and I enjoy working for the community, the public, in general. I like to protect, and I enjoy to protect, the health of the public, and that is my job, and that's why I choose to be a health inspector.